CBS News medical consultant Dr. David Agus is with us from Los Angeles. Doctor, good morning.
Good morning, Nora.
So we heard from the head of the CDC that there is zero risk of transmission when this patient flew on a plane from Liberia to the United States. Is there really zero risk?
It's such a hard statement to say zero risk. You know, United now is contacting the passengers on those two flights that were United flights. So transparency is important. At the same time, the way this virus works is a small number of particles get in through the mouth or through a cut, and then they grow. And once they hit a critical mass, you get symptomatic. But what about an hour before you're symptomatic? What about a day before you're symptomatic? The truth is, we just don't know. So this patient was days before, presumably they were symptomatic, so one has to assume they weren't infective at that time. But how do we know he's actually telling the truth about when he was symptomatic? You know, there's questions about whether it was true on the form. Did you have contact with the patient or not?
Or if he even knew what he was dealing with. The other thing that I think is concerning, it's been reported about the NBC cameraman. I heard this morning that he was totally covered, that they had even taken extra precautions, yet this guy's still got the disease, which makes me think, how worried should we be, David?
Well, we don't think it's spread by airborne, but it is spread by a small number of particles. And so the science is new, and the virus today is different than the virus a year ago or 2 years ago. There's small molecular changes. So we, in truth, don't know that much about the transmission. At the same time, there shouldn't be panic. At the same time, there are a very small number of cases here in the U.S., and compared to viruses like measles, it doesn't spread as quickly.
David, where are we in terms of what can be done once a patient has Ebola?
Well, right now, we don't have much except what we call supportive care. You give them fluids, you can give them antibiotics. There are other infections, bacterial infections, but we don't have anti-Ebola treatments. We haven't been able to scale them up. We think we may have some that would work, but they only exist in very small numbers, and most of them have been used. And so we have several months till we can actually have a supply that can treat people. So right now, it's at a critical juncture. We have to hold it in Africa, and we have to contain it here.
All right, Dr. David Agus, thank you.